Okay. So hello everybody, I'm Frank. I'm a physical therapist and founder and CEO of Virtualis. So we'll talk about how virtual reality is changed maybe already physical therapy. A brief history of Virtualis and how this project came and how we brought head-mounted display into physical therapy practices. So it came really from a clinical need. I was with my patient, I was more focused on the balance disorders, vestibular rehabilitation, and motion sickness rehabilitation. And I was looking for solutions more efficient for my patients, or to be able to treat weird conditions, let's say, that had no specific tools or not efficient enough, such as the motorist disorientation syndrome. It's a condition where you can't drive anymore on the highway. You can drive in the streets, in the city, but not on a highway. So there was no specific tools for that. So we started with motion sickness with the first head-mounted display that was available and affordable, the Oculus Development Kit 1. Then balance disorders, and then HTC Vive came with the trackers. So it's enabled to open to global physical therapy. So it was my first VR concept, my first head-mounted display. Of course, everyone laughs at that. It's a bee protection headset. It was supposed to reproduce, and it worked pretty well, in fact, to reproduce what you experience when you're at the back of the car and you cannot see the road. So you have a inner ear and vestibular passive stimulation because you're not driving yourself, but you're not seeing the movement you're experiencing. So it was the same. The patient was seated in a rotary chair. I was turning him passively, and he was reading something without seeing the scenery moving around. So that was effective, but not easy to reproduce. So I was expecting VR would come to a larger and wider market with less latency and all that. So then I tried these 3D glasses with YouTube sequences I downloaded. The one on the right was for motorist disorientation syndrome, for balance disorders. It was not really effective because you saw a screen like being in a movie theater, and it was not immersive technology. So then the head-mounted display, as you can see on the right, it was in 2014 with the Oculus Rift DK2, and the kind of applications we developed during all these years. So now what VR brings to the therapist, on the therapist point of view, the physical therapist, but also occupational therapist, it's one equipment for most patients. So most conditions can be treated with just one setup. You don't need to have a large room, and the cost, of course, you buy one equipment and you can treat most of your patients with that. You have all this data to monitor rehabilitation process. So you're able to show your patients how he improved on the rehabilitation process. You can adjust all the parameters, the settings, velocity, amplitude, range of motion in real time while he's doing the exercises. You have more realistic conditions. So what you do in your practice, it will be easier to be effective in the real life, of course. Faster results, so better turnover for the physical therapist. Usually physical therapists, especially in France, we have too many patients. So someone calls us and you have to tell him, okay, I can take care of you, but in 2 or 3 months. That's too long. So having a shorter rehabilitation process makes a better turnover. Sorry, and the image of the clinic, of course, it brings value because you use the latest technologies. So a few customer testimonials, so that's physical therapists or doctors. 50% of the rehab time is saved after 3 weeks of use, so they can see they use 50% of the time needed for rehabilitation for the same results. So that's huge. It's a tool we were expecting. Results come faster, so that comes a lot. Results come faster. The product is phenomenal. I like this one. This is very American, of course. The software program and Virtualis are a major asset to our clinics. with combination of force plates, that's another device we have developed, and VR, we've been able to carry out all of our clinical and rehabilitation assessment on a single affordable system. That's exactly what I was telling you. Just one device and you can do most of your rehabilitation process. Now, what VR brings to the patient themselves. For the patient, I say what the brain believes the body can. So if you can trick the brain and make the brain believes the body is able to do that, the body will be able to do that, because that's the rehabilitation process. We don't rehabilitate a condition, rehabilitate a patient. And what drives the patient? His brain, of course. So for kinesiophobia, the fear of pain, fear of moving, for phantom limb pain, for stroke, hemiparesis, all that kind of conditions, it's very easy to achieve better and faster results if you can trick the brain. So it's really life-changing results for a lot of patients. That's a testimony. No, that's a video. 50 years old patient suffering from congenital right hemiplegia. So it means he was born like that, and he has been doing rehabilitation all his life. That's the first evaluation. It's an occupational therapist evaluation to try to grab coins and bottle caps. After 2 months of rehabilitation, let's see, yeah, so it's 2 months using our mirror therapy system for stroke rehabilitation. 3 times a week, 30 minutes. You see the results. It's 2 months of rehabilitation and 1 month stop to be sure the effect will last. So that really changes his life. And it's all about VR because he was doing the rehabilitation before, and that's before and after VR. That's, yeah, no sound, so I will explain just. After concussion, she was feeling very dizzy, and she has been doing rehabilitation for years. And after, I think it's 2 months, she was able to recover a kind of normal life. Another patient, 57 years old, stroke 2.5 years ago, left hemiparesis. Again, rehabilitation before, evaluation before the rehabilitation process. We ask him to turn the cards. That's how he uses his hand. And after 2 months of rehabilitation using our system, you see he's able to grab the card and turn his hand. That's not magic, that's just, and able to grab a can as well. The connections were there, but the brain was thinking and abandoned the effort to make the hand move because it was too difficult. But showing in VR and taking the patient out of the rehabilitation process in a VR environment make the brain believes, okay, I can do that with my hands because it's a mirror. So then the effort is done and he's really trying to achieve this kind of tasks. So now VR for PT, so far it's just our numbers, so I believe there's a lot more. We have over 500 clinics equipped, 70% of the French vestibular physical therapists. That's a lot. And we have treated more than 250,000 patients with head-mounted display. Usually when we think about VR and health, we think about training, about surgery training or anatomy, but not that much about patients wearing this head-mounted display themselves and using VR for their rehabilitation. So that's really what we're proud of, is every patient is using this kind of technology for better results and faster results. And we are in 28 countries. So we have a few publications and abstract published as well. And that's in a few minutes. I think the timing is okay. Okay, perfect for questions. So that's the kind of things we can do. Relaxation, that's kind of exercise for upper extremity or lower extremities as well. The mirror therapy, and you can see we can treat from children to very elderly people. That's for shoulder and cervical, spine and spine rehabilitation. So you can see it can be used as well by older patients. This is bending for spine rehabilitation. This is for balance disorders. Patricia enjoyed that a lot. You see the reactions. So through just visual stimulation, we can have a real impact. This is rotation for spine rehabilitation, for lower extremity and sports medicine, of course. This is using the force plates we developed as well for balance disorders and transfer. For limits of stability, to be able to learn how to bend and to be secure. And I think that's it. So if you have any questions, I'll be pleased to answer.
Thank you, Franck, for your presentation.
Merci beaucoup.
Yes.
Hello. I was wondering, you already equipped a lot of physical therapists professional. Would you imagine that in the near future, patient could do the same exercise at home without the ability to, without the need to go directly to the physical therapist to maybe have a lesser long list of patients with those equipment?
Would you ask a baker if a customer is able to do his bread at home? No, I mean, I understand the question, of course. I think the therapist is key to the rehabilitation process. That's the first thing. Otherwise, we wouldn't be there. Everyone would be able to do his rehabilitation. We always ask patients to do rehabilitation exercise between sessions, so that's true. That's a question I'm asked a lot. There's a legal aspect first, because when we work on balance disorders, we need to be standing. Working on balance seated has no meaning. So you can fall. And usually patients at home want to go faster and to recover very fast. So they would push the settings and they could fall. Now we are always standing. So if they fall, who's responsible? So that's the first aspect. Then I need to be sure the settings are exactly what the patient needs. And that's one thing we do is during the exercise, even if it's 5 minutes, we adjust the settings in real time. So that's very important. You know, if you're asked to do something like that, after maybe 10 times, you're able to go a little bit further. And that's key to rehabilitation. So that's not something you could do at home. So maybe you could do some things at home, seated for security, of course, for, let's say, cervical spine. That's not something we do at the moment. Some do. So it could be like an add-on, and to have, again, faster results, to keep doing a few exercises, because it's true when you ask a patient to do something at home, you don't know if he did it or not and how long. And so that could be a way to monitor his home exercises. Maybe we will in the future, but very secure.
Yeah, okay, thank you a lot.
Any other?
Hi, thank you for your talk. So I was wondering how important is in your experience or in your patient's experience the sense of embodiment and presence for the results of the rehabilitation, and if you measure it in some way.
I'm not sure I understood. The feeling of presence, is that really important?
Yeah, the presence and embodiment, how important it is for the results.
It really depends on what we are doing. One thing that's for sure is the quality of the graphics is not really important. The motion is more important than the quality of the graphics. It depends, I think, on the emotional aspects, such as driving on the highway, for example. It's important that the patient is really feeling he's driving, because he will take his car after that. So we have steering wheel and pedals. So I think it's important for some conditions. The feeling of the hand, let's say, that's a good example. At first, with the lip motion, we had a gray hand. So that's not realistic at all. But I didn't want to have a too realistic hand, because the more close you are to a realistic hand, the more the patient will focus on my nails are a bit longer, my skin is not exactly the same color. When it's gray, you focus on the movement, and that's what we want. So it really depends. I think for emotional and psychological aspects, you need to be close to real life, really, because there's the experience, and you will be back to the real world. And for motion, for balance, for other things, it doesn't really matter. What's important is to take the patient out of the rehabilitation clinic and to bring him where you want him to go. Full body tracking will be great, but it's not that good at the moment.
Thank you very much.
Just a question, your products look like games, in fact. Is it important how your patients see these products? Is it a rehabilitation tool or games or both between?
It's not really games. The graphics maybe a little bit. It's because we would not be able to ask our physical therapists and the clinics and hospitals to change their computer every 2 years because there's a new generation of head-mounted display. We started with the Vive Consumer Edition. Now we are on the Vive Pro Eye, but it's still with the same computer. So we cannot bring the graphics to their maximum.
Okay, it's not exactly my question.
Sorry.
I want to know if gamification is important in the process.
Half of it, yes. Not completely, but for motivation, for the will to go back. Let's say I had an injury to my ankle. I had 15 sessions. I stopped after 10. But maybe if I was feeling happy to go to the physical therapist because I had fun, that's motivation, and that's really important. And the more the patient believes in the rehabilitation process and is motivated, the best the results will be, because again, he's key in his rehabilitation process and he's a real actor. So the gaming, the rewards, to see the results, and more in these times, we need to show them and to prove why we ask them to do that. So having evaluation, and after every session saying, see, you touched 15 stars, and last time it was just 10, so you're getting better, then he's really getting better. So the gamification is important in the rehabilitation process, that's true.
Thank you very much, Franck.
My pleasure.